Following the temporary closure of Makerere University by President Museveni, hundreds of medical students and their lecturers at Makerere Medical School accordingly withdrew from Mulago Hospital, where they had been treating and handling patients as part of their medical studies. The medical students and their lecturers constituted a huge part of the medical staff strength at both Mulago and the subordinate hospitals of Kawempe, Chirudu, and other Kampala Capital City Authority health centers. The medical students and their lecturers constituted a huge part of the medical staff strength at both Mulago and the subordinate hospitals of Kawempe, Chirudu, and KCCA health centers. The medical students from the subordinate hospitals and health centers in the city divisions replicated the action of their counterparts at Mulago Hospital and withdrew their services in the wards, triggering a similar paralysis of work at the health facilities. Dr. Byarugaba Baterana is the executive director of the National Referral Hospital, when contacted early this week, intimated that some professors were back to work as part of the contractual obligation with the patients, while some have been holding discussions with the university administration.
We have postgraduate students. These are qualified doctors. Indeed, it is very true. We work with them on the patients. As we work on them with the patients, the relationship is symbiotic. They work on our patients. As we treat, as we offer them training, we train them. They sleep in our houses. You see, the doctor's village is full of those people. We don't charge them on those, and they're enjoying the water, the electricity of Mulago Hospital, the government of the Republic of Uganda, and so postgraduate is like carpentry or bricklaying. You cannot learn carpentry or bricklaying in class. You only learn it by doing it. So postgraduates, they cannot. There is no way they can get that degree without working on patients or treating patients.
More than 300 medical students under the category of senior house officers who are qualified doctors, popularly known as postgraduate medical students, together with more than 200 lecturers withdrew from Mulago and their affiliated hospitals. During this period, the hospital experienced some inconveniences as they solely depended on the hospital doctors. Days after the closure of Makerere University, Education Minister and First Lady Janet Museveni ordered the opening of the university's College of Health Sciences to allow postgraduate medical students and consultants continue with their work. According to Dr. Byarugaba, the situation has since improved, with some students getting back to work.
There are many discussions between Minister of Education which have been ongoing and have yielded good fruits. So they have said that these people should come back, and I know they are preparing themselves to come back because they also know they can't do without treating patients. Otherwise, they will not gain the necessary experience required to be a specialist.
In a few days, how have you been coping?
Where you see, where you have, where you would normally have like 10 doctors, you get like 8 doctors. Meaning, if you have been taking 10 hours to complete the line, now you take more hours to complete the line. But we continue to cope. There's nobody who has died because the postgraduates are not here.
However, some postgraduate medical students had insisted they would not return to the hospitals as they risked being attacked by other students, and as of today, most medical students are back to work.